Hi, welcome again to Essential Nursing. This is your tutor, Nurse Judy, reporting for duty. The next class of antihypertensives we'll be talking about are beta blockers. By the way, this was my best medication subtopic in pharmacology, and you'll see why. Let's dive in. Beta blockers, also called beta adrenergic antagonists, are a class of medications that block the action of norepinephrine and epinephrine on the beta receptors in the body. They help lower heart rate and reduce blood pressure and can manage other cardiovascular issues. They generally end in LOL. I like to say they make a furious heart go LOL. If you're having a wacky heart situation, you better laugh out loud. You get it? I know you get it. Moving on. There are two types of beta blockers: the beta 1 blockers, or the selective beta blockers, and the beta 2 blockers, or the non selective beta blockers. Mechanism of action. How do these medications work? Beta blockers primarily work by blocking the beta 1 and beta 2 adrenergic receptors. Beta 1 receptors are found mainly in the heart. They are always ready for adrenaline binding during a fight or flight situation, forcing increased cardiac output and increased blood pressure. By the way, the norepinephrine and epinephrine I mentioned earlier are just fancy names for adrenaline. Note that the blood pressure here the blood pressure increase here is because of an increase in blood volume. Beta 1 blockers are selective only for the heart. Blocking these receptors slow down the heart rate and decrease the force of contraction, which reduces the workload of the heart. This is because adrenaline is unable to bind. Pretty straightforward, right? I thought so too. They are used to treat hypertension, angina, heart failure, arrhythmias, and myocardial infarction. That's heart attack. They are your metoprolols and your atenolols. Beta 2 receptors, even though present in the heart, are mostly in the lungs and blood vessels. Blocking these receptors can cause bronchoconstriction, narrowing of the airways, and vasoconstrictions, narrowing of the blood vessels. Beta 2 blockers are called non selective beta blockers because they not only reduce the heart rate, which is basically their job, but because of beta 2 receptors' prevalence on the blood vessels and lungs, they may result in difficulty breathing and reduced blood flow, not reducing the blood pressure as much as it should because the blood is pushing harder than through the blood vessels. As you can already tell, this would not be the best medication options for patients with chronic lung diseases like COPD and asthma. I know what you're thinking. Why would a medication that causes reduced heart rate also cause increased blood pressure? During a fight or flight situation, adrenaline binds to the beta 1 and beta 2 receptors, forcing the heart to beat at a faster rate, leading to increased cardiac output. Cardiac output is just the volume of blood pumped out by the heart per minute. So it increases the cardiac output to the extremities, to the skin, to the guts, hence increased heart rate. Adrenaline also binds to the alpha 1 receptor at that point, which is prevalent on the lungs and airways, causing vasoconstriction and bronchoconstriction, leading to increased blood pressure. Beta 2 is supposed to counter the effects of alpha 1, but when the receptor is blocked by a non selective beta 2 blocker, vasoconstriction and bronchoconstriction happen anyways. It is important to know that the intention of beta 2 blockers is not to cause vasoconstriction or bronchoconstriction. It just happens. Before I forget, examples of beta 2 blockers are carvedilol, propranolol, and labetalol. Side effects. The common side effects of beta blockers include bradycardia, that's too slow heart rate, fatigue and dizziness resulting from low blood pressure, especially with beta 1 blockers, obviously hypotension, possible vasoconstriction or bronchoconstriction with beta 2 blockers um, when beta 2 blockers are used. Drug interactions. Beta blockers may interact with the following medications. Calcium channel blockers, like your cardizem, your verapamil, and the ones we discussed the last time. Calcium channel blockers can lead to excessively slow heart rates. Remember from our calcium channel blockers tutorial. Calcium channel blockers help reduce the contractility of the heart. So using it along with beta blockers will really slow down the heart rate. Diabetes medication. Beta blockers can mask the signs of low blood sugar, that's hypoglycemia. Your patient might become clammy with cold sweats. Other antihypertensive drugs can also interact with beta blockers because they may enhance the blood pressure lowering effect. Patient teaching. Do not stop beta blockers suddenly. Stopping them abruptly can lead to a rebound increase in blood pressure or other complications. Always taper off under doctor's guidance. Monitor heart rate and blood pressure. Patients should generally check their heart rates and blood pressure. Take with food. Some beta blockers should be taken with food to avoid stomach upset. For example, your metoprolol. Watch for side effects. Notify a doctor if experiencing excessive dizziness, fatigue, or trouble breathing. Be cautious in asthma patients. If a patient has asthma, they should generally avoid non-selective beta blockers, as this can worsen bronchoconstriction. This brings us to the end of today's tutorial. If you have watched till this point, please endeavor to subscribe. Also comment on the next topics you want me to teach about. Like and share with other nursing students you know. Turn on your notification buttons to be alerted whenever I post. Thank you and see you in the next video.